The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston, Texas with my Houston surgeons. And today we have on Dr. Eric Smith. Welcome to the show.
Thanks for having me.
So, Dr. Smith, some people know you, some people don't. Tell us a little bit about yourself.
Well, I am a bariatric surgeon in Georgetown, Kentucky, which most people don't know where that's at, or they think it's in D.C., but I'm just outside of Lexington, Kentucky, here in central Kentucky. And I've been a bariatric surgeon for, almost 19 years now. I'm the medical director of the Kentucky Bariatric Institute, which is our practice. And I'm also a medical director for all of robotics and bariatrics for LifePoint Health. So that's the health system that I work in. So I get a chance to help develop other robotic programs and bariatric programs across the country. So that's about all I got.
Well, tell us, how did you get into bariatrics? I actually don't know this, and I bet you know the answer to this, is when did the field of bariatrics really kind of get established?
Oh gosh, you're going to put me on the spot. And I'm sure somebody's going to comment on this and be like, that's not right.
Estimates are okay.
Yeah, bariatrics has been done for years, but I think what's so interesting about bariatric surgery is it would be like someone saying, I had plastic surgery, and they think it's all the same. And I know that would be humorous for you. There's so many different surgeries that you could do. But for some reason, bariatrics gets lumped in. And I think the downside to that is it has changed so much, not just the types of procedures, but how we do the procedures. I'm sure we'll talk about that today. So to go all the way back, people were doing forms of weight loss surgeries, where it was really focused towards that, back in the late 70s and 80s. But what they were doing then is not anything that we're doing now. I guess if that's probably the best way that I could describe it. And a lot has been learned, which has had a significant impact on not only outcomes and weight loss, but risks and complications and things like that. And so a lot of those misconceptions about bariatric surgery is based on data that's 30 plus years old.
Yeah. Yeah. Well, what really interested you and got you into the field?
I think the story that a few people may have heard me tell, but a lot of your listeners probably haven't, is where I trained. If you're a bariatric surgeon, you have to be a general surgeon first. And bariatrics is just a subspecialty off of general surgery. So during my general surgery training, in Dayton, Ohio, I was very fortunate. I trained at a location that we were the first center of excellence for bariatric surgery in Ohio. And I'm dating myself, but the beginning of my residency, we were doing open gastric bypasses, but we were doing a significant volume of those. And I got exposed to a lot of bariatric surgery. And kind of a cool story, laparoscopy was starting to really penetrate the market in bariatrics. It was tough. It was limited to low BMI patients. It was taking them 4 and 5 hours to get a gastric bypass done when we were doing those in 45 minutes open. But we knew that there were better ways, And what happened was my trainers brought in a new partner who had just finished a fellowship. And part of his fellowship, it was a minimally invasive fellowship, but bariatrics was one of the emphasis. And they really brought him in to not only add to the practice the ability to offer laparoscopic bariatric surgery, but more importantly, to also teach them how to do it. These surgeons were well into their career. They were in their mid to late 50s, early 60s. And so when he came, I was fortunate enough at my program. We were a smaller program, so we had 3 residents per year, but there was a couple years where we would only have 2. And the class ahead of me only had 2 residents. And so I got asked during my going into my 4th year of residency, which general surgery is 5 years, to be chief resident with him because the other 5th year was leaving to go do a fellowship. And so, as you know, normally chief resident, that's saved for your last year. And I got asked to split chief duties with him. So I was very honored by that and grateful. But I also knew my case volume was going to be significant. And when this new guy came in, I told him, I said, look, you're going to get a medical student to drive the camera for your first laparoscopic gastric bypasses. But I will bypass being the chief surgeon in another room because I'm going to have plenty of these gallbladders and colon resections and hernias. And I'll come drive the camera for you instead of a medical student. But what I'm asking of you is when you get ready and you're comfortable, you've got to teach me how to do a laparoscopic gastric bypass. And I really looked at it as if I could do a laparoscopic gastric bypass, I can learn to do anything.
Yeah.
I have to admit, it was the selfishness of you remember those days. You want to do the big cases, the cool cases, because that's how you're developing your skill set. And so he's like, yes, if you'll do that for me, I owe you. And so I stood there and humbled myself and drove a camera as a 4th year, but chief resident for about 25, 30 cases. And then he started saying, okay, we're going to start with the jejunal-jejunostomy, the lower part. You have this much time. If you get it done, I'm going to let you keep working. And before too long, I was doing laparoscopic gastric bypasses in my 4th year and completing those cases. So then I took it another step further. And we had our resident clinic, which, that's where we learn, right? We learn how to operate in the operating room, but we have to learn how to manage patients. And in the resident clinic, it's, as you know, many times for the indigent care, the uninsured, the state or government insurance. And my trainers were all in private practice. So they didn't offer bariatric surgery for the state insurances. And I said, what if we start a bariatric clinic for the residents? We'll learn how to manage these patients, but the deal is anybody that qualifies to be done laparoscopically, I get the case whether I'm in the clinic or not, because I'm the one that's put the time in. And he said, that's fair. Let's do it. So we started a bariatric clinic. It was a great experience for the other residents. They were learning how to do open gastric bypasses, but they get an open gallbladder out of it. Exposure of an abdomen on an obese patient, which you need to know how to do if somebody comes in the middle of the night in an emergency. But that's when everything changed for me, because I went from being a cool surgery to taking care of a patient in the clinic, and I saw the impact that it made in their life. People within weeks off their diabetes medications, talking about that they were able to get a different job, play with their kids, do all these things. And then I was addicted. I'm like, I got to do this. This is the most rewarding thing in the operating room and out of the operating room for the patients that I take care of. And the rest was history.
Well, and for our non-medical listeners, just listening to how you kind of work to figure out like how you could become the expert in that area, like that's a recurring theme you'll hear amongst surgeons, right? Like, I figured out a way, I did what I needed to do to get there. And so I'm not surprised at all, because you've become a leader in the field, and it's because it started that early, right? You're like, I know what I want and I'm going to go for it.
Yeah, absolutely. Absolutely.
Will you explain a little bit about what a center of excellence is for bariatrics?
Yeah, so centers of excellence exist for other things, but it's been really important in bariatrics for years. And really what it is, and there's kind of 2, we'll call them governing bodies that you can have that under. And some of that has changed over the years. But the long and short of it is, for the non-medical person out there, you have to collect your data. You have to collect very detailed data and keep it up to date and accurate. But you also not only have to collect your data, you have to meet a lot of metrics. And that is, number one, you have to do enough volume. You have to do enough of these surgeries, but your data has to show that you're as good or better than the other high volume centers that are centers of excellence. So I've been a center of excellence surgeon for years, the majority of my career. But you still go under repeat inspections. This year is our year to recertify. So someone from that governing body will come in, spend a couple days with us, go through our charts. They'll pull out any chart and ask questions about it. If there was a complication, they'll look into it. They want to know why you did what you did. Your furniture is appropriate for patients who are overweight. Your doorways, the bathroom facilities, and also all the care teams that surround you, your radiology department. So it's something that we're very proud of. Some insurances require you to be done at a center of excellence. So there's lots of insurance like Blue Cross Blue Shield has their Blue Cross Blue Shield distinction. And so there's multiple layers to that, but that's essentially what it is.
And I think that it's, gives you more sense of security as a patient because you know that that if somebody has that, they've met a certain standard, right?
Right.
And you don't get that with people who dabble in bariatrics. And so
Exactly.
it's a safety issue, and safety is always the most important thing here.
Yeah, absolutely. And I'm sure there's a lot of different procedures that you do, but there's obviously some procedures you learned in your training that you don't do just because either not only that you're not interested in it, but you just don't have the volume of it. And we all know that people do a really good job when they do a lot of something, and you don't want somebody that dabbles in anything. We can't be good at everything. I think the reason that you're successful like you are, and I hope part of the reason that I am, is we figure out what we're really good at and we work really hard at perfecting that.
Exactly, exactly. I know you also do a lot, and you do training. You're a trainer as well for robotics. So, can you
Yes.
explain kind of when did robotics kind of really enter into the bariatric field, and like what are you really utilizing that now for?
Yeah, so I trained in 2012. And that was probably a little early for the general surgery, definitely early for the bariatric realm. I looked at it for a while. It really kind of exploded in the urology and GYN world. It allowed a urologist to do a prostatectomy through small incisions where there was literally probably 10 or less surgeons in the country that were able to do that laparoscopically. It was just too challenging, and it changed the game for how people were cared for when it came to prostate cancer and things like that. So as it started to be kind of proposed to general surgeons, we were pretty proud of our laparoscopic skills. That's what we're trained at doing. And we kind of, and I was just the same, we fell into that trap at the beginning of saying, well, what's this going to let me do that I'm not already doing? Um, but when I really started to look at the technology, I knew that it was evolving. And I watched it for about a year and a half, and I realized, I may not exactly know the where I'm going to use this in my practice, but I know that it's going to offer things to me for my patients that will be game changers in the future. And so I started teaching in 2012, primarily for general surgery. I was still doing general surgery as well as bariatrics during that time. And then in 2013, I started applying it to some of my bariatric surgeries. And I realized even though some of the technology that we have now, such as staplers and things like that, was not available, I knew that there was significant value. And so in 2012, I was a case observation site for intuitive and general surgery when there wasn't a whole lot of us at that time. And then from that point forward, I've been involved with intuitive surgical in teaching, leading courses, a key opinion leader for them, and I now sit on their surgeon advisory board, which is really cool to see. We get to peek into the future to what's coming, down the road as well, and really get to to mix with the engineers behind the technology and the business side, and really seeing the mission of how it changes how we care for patients.
Because with all of our specialties, we're always trying to do better, right? How do we make things better? And just even from the time you trained, right, to now, like how much has changed?
Absolutely, absolutely. And it's funny. There was there's still some people that do it laparoscopically, and that's okay. That I don't ever think that I'm better because I do it robotically. I personally believe it gives an advantage to the patient and the surgeon by doing it robotically, but I would never bash somebody else because they choose to do it laparoscopically. That's for them to decide. But it's interesting here recently. There was maybe a couple surgeons that made a post about almost casting fear in the robotics of, oh, I would never use a
Yeah,
robot,
yeah.
almost like I don't need a robot. And I'm like, unfortunately, I think there is a very discrete difference between confidence and arrogance. And I think in the surgical field, we have to be confident or we're not going to be good at what we do. But I believe confidence is that person who still is willing to humble themselves to say, but can I do it even better? You know? And arrogance is that, unfortunately, that trap you fall into of like, I'm good and there's nothing that could be better than what I'm doing because what I'm doing is good enough. And I think that's dangerous when it comes to medicine, And so I think we always have to evaluate technology. It doesn't mean you always pick it up. But I think what robotics has offered us has just been a massive advantage for the patients, but it's been a huge advantage for us as surgeons too. So I think it's going to extend our careers and allow me to do much more complex surgery in a very predictable way, and patients recover just the same as if it was the first one they've had.
And I think that that's the key is like a very predictable way. Anything that takes out, more predictable we are, the less potential for errors and less potential for complications. So I think you make a good point too with you want your surgeon to be confident, not arrogant. You don't want somebody coming in and being like, I think I'm going to be okay with this surgery. I mean, that would make me nervous. I wouldn't want you to touch me with that.
Exactly.
But you do want us to always be students and always learning to do things better because medicine is very dynamic where it is not a static field in any way.
You're exactly right. And in the day and age of the way technology's evolved and machine learning and AI, I feel very confident. And like I said, I'm very fortunate. I get to peek into the future, but there's no robot that is operating on a patient and it will not operate on a patient. That will always be surgeon led. But, for the listener out there, imagine for a second, hypothetically, although I have to say that because of some agreements that I signed, but imagine for a second, me as a surgeon, when I operate, I always have game film to review, just like a top notch athlete. But more importantly, I have game film that I can review. And now I have AI that can evaluate that game film and see the parts of the surgery compared to the best of the best in the world and say, but you could actually improve your time here, or you could improve this here. And oh, by the way, here's some simulator exercises that you can practice and use to perfect that. Not just you could get better, but here's how you'll do it. That's where we're going with this. And why in the world would a patient not want their surgeon to constantly be learning? And I think the day we as surgeons ever feel like we've got it all figured out is the day we should retire.
Yeah. Well, I like that. It's like an AI attending. It's like,
yes.
Without the anger.
Yeah, exactly. Without the belittlement, just wanting to make it better, right?
Just the good stuff. So I got to ask you a little bit. I mean, a lot of people may recognize your name from being on 1,000-Pound Sisters. How did you get involved with that?
It was a little random. Many years ago, again, I'm dating myself. This was before Zoom and the days of Skype. Someone had reached out to me from the Discovery Network about a new show that they wanted to do about surgical weight loss in families. And I contemplated. I wasn't convinced that I was going to do it, but I did some interviews. And long story short, at the last interview that I did, and they were all excited and asked if I had some recent examples. I said, yeah, I just did a husband wife this week and two sisters about a month ago. And they said, okay, but do you have any that don't speak anymore or that are now divorced? And I said, you know what? I don't think I'm your guy.
Yeah.
So I let it go. And then I guess it was right around 2019-ish. It was before COVID hit. My office manager said, hey, somebody from Discovery Network called and they want to talk to you. And I'm like, yeah, whatever. And I threw it on my desk.
Yeah.
And about a week later, she's like, did you ever call them? And I said, no, I did not call them. And she said, you should call them. And one lady in my office, she said, I wonder if it's about the 1,000-pound sisters. And I'm like, who's the 1,000-pound sisters? But they're from Kentucky, and my staff followed these ladies on YouTube. So I called, and sure enough, it was. And they had done some research on me. I was pretty resistant. I really didn't want to have anything to do with it. Nothing against them. I just didn't want it to get in the way. And I'll be really honest with you, without stepping on anybody's toes. I wasn't really happy with the narrative at that time of obesity and weight loss surgery on TV. I felt like that a lot of the times the shows were more about demeaning the patient or belittling the patient, and at their expense of why people were tuning in. And it really wasn't bringing the humanizing element of like what they were going through too. And I remember sitting down with my CEO at the time, because there was going to be some legal paperwork that had to happen if we agreed to do that. And he said, I told him that same thing. And he said, well, I guess the only thing that I would say to you is I understand where you're coming from, but what if you have the opportunity to change that? And I looked at him and I said, you know what? You're right. And so for that reason, I'm going to do this. And I guess the rest was history.
Yeah. Well, and I mean, the show has become an inspiration for a lot of people. So I think you've done a good job with it. And I think they've done a good job with it at making it something that's really focused on health rather than, and there's fun. Obviously, they're hilarious. But like
Yeah.
it's, but it's really done a good job in focusing on the right things.
Yeah, I think so too. I was really clear that nothing I'm going to do is going to be scripted. I might have to repeat something because my accent was terrible or my grammar was terrible, but I wasn't going to do something I wouldn't normally do. I wouldn't operate on somebody if I wouldn't normally operate on them. And I've been happy with it. I think the most rewarding thing is the number of messages of people reaching out to me to simply say, "Hey, you gave me the courage to go see a bariatric surgeon." And I knew that there's bariatric surgeons out there that would treat me in the way that I wanted to be treated. And that's made it all worth my while. Not because they came to see me, they went and found someone local to them. But if I can make a difference for people to have the courage to do that and change their life, that made it all worth the while.
That's awesome. That's awesome. And, like I said, you're making a big impact in the world of bariatrics for sure. One thing I know, you've got some new exciting news of something that you've been working on for a while. Do you want to share that with our listeners?
Yeah, yeah. So, probably, probably a little over a year ago, we launched a supplement line called BariBalance, which is really geared towards weight loss surgery patients or people just on a weight loss journey of, vitamins that are geared towards people who've either had weight loss surgery or just anybody who's wanting to make sure that they get their essential nutrition while they're watching what they eat and their calories. And that's been great. It was rewarding, but there was a product that was part of that was really just something very basic as protein water. And it's really got a lot of people excited. And a buddy of mine who runs a gym here locally, he had it and he said, "Man, this is amazing. Can I put it in my gym?" And I said, "Yeah." And so his clients loved it. It's 12 ounces of water with 20 grams of protein, no sugar, no fat. It's 80 calories, but it's not chalky. It's not milky. Like nobody wants to drink that after they're hot and sweaty working out. And he said, but I'll be honest with you, when they looked at it, they weren't sure if it was for them. And I'm like, well, Matt, it's protein. And he said, yeah, no. He said, I think it was just because they saw your label or the brand. And I'm like, so it got me thinking. And so we've just recently, the website is actually live. We haven't really announced the launch, but the website is live. If you go to drsmithsproteinwater.com, and we've launched our protein waters really for the people that need protein, which that's everybody.
That's
right?
everybody. That's literally everybody.
The health
yeah.
conscious person that is into fitness, working out. There's so much emphasis now with the GLPs taking the America by storm about needing, say, losing weight, but they're not emphasizing muscle mass. They're not emphasizing needing to prioritize their muscle mass, and they're losing so much muscle mass. And so people are now learning that, gosh, when I regain weight, it's not because my surgery failed or something else failed. It's because when I lost weight, I didn't prioritize muscle mass. I just lost weight. And so I think it's been a great product for us to really raise awareness about you have to hit those protein goals if you want to lose weight the right way and make it last.
Well, and I think one of the things to point out and why I wanted to bring it up for sure is that there are plenty of people making things who don't have your background, who don't have your knowledge, but they're just making it to make a buck. And it is a very different thing when you have someone who's basically dedicated his life to taking care of people and to making sure people are healthy. So this is coming from a totally different place, which I think is awesome.
Yeah, I appreciate you saying that. Yeah, I mean, it's kind of a labor of love of like really trying to. You're careful what you put your name on, obviously, but this is something we're really excited about.
Are there any other exciting things coming down the road for you, or anything you're super excited for, specifically in the weight loss field?
You know, I think there's so much evolution in the technology that we use surgically. Like I said, I get to peek into the future, and some of that stuff I'm not allowed to talk about. But I think the next 5 years about the information that we will have as surgeons to truly get better. I don't. I'd love to know your opinion on this, but for years I always felt like a surgeon, yes, he or she had to have good outcomes, but it was more about if you had the right people in the hospital pushing the right pencil and paper and the numbers and the data, then they could achieve certain metrics. And no one ever really stopped and came in the operating room and looked at what we did with our hands, looked how precise we were, looked how meticulous we are. And we now, on the robotic platform and the Da Vinci platform, we now have technology that can really focus on how can I be the most precise, gentlest surgeon I could possibly be, and combine that with our outcomes, combine that with how quickly people go home and preventing readmissions and stuff. And so that really gets me excited and fired up. And I think with GLPs, it's a great thing. I think they're being overutilized. I think that they're not a magic pill, but the more treatment options we can have for people who battle with obesity, the better. And I think the one great thing that's come from that is if Big Pharma did anything positive, they used their dollars to raise awareness in the fact that obesity is a chronic disease. And we hadn't really been able to get that message, and it feels like the public is finally understanding that now and showing some empathy towards these people who struggle with this, and not making judgments when they seek that out. So, life is good, and there's a lot of exciting things of just being ready to change with how the whole medical spectrum changes.
And I think that's a big part of it is it's not enough for us to come up with these things. We need to change the way people think. And so I would agree with you that if we're starting across the board, that message is being changed, then I think that it just opens us up to reaching more people and people really understanding why we're saying what we're saying.
Absolutely. Absolutely. I completely agree with you.
Well, thank you so much for being on the show. This was awesome having you. I know that we're going to have some people listening today who are like, well, how do I get in touch with Dr. Smith? So what would be the best way for someone to learn more about you?
Yeah, I mean, really the only platform I'm on social media wise is Instagram. That's all I've got time for. But if you go to Dr. Eric Smith _, that's my Instagram handle, and always try to use that for a platform of just education and information. We try to do some fun stuff too. My practice website is KentuckyBariatricInstitute.com. So you can go there and find out if you have questions about surgery and things like that. And then, the new website for the waters is Dr. Smith's Protein Water. It's pretty simple. .com, and the waters are on there. And then BariBalance.com. That's BARI for bariatric. BariBalance.com is where our other vitamins and supplements and things like that. And even for people that have plastic surgery and stuff, we have some collagen products and some hair, skin, and nail products and stuff like that too. So, you can find me there, and then obviously the stuff that I'm involved with Pop.
And that's where we kind of really got to know each other better because we are both the medical directors on me on the plastic side, Dr. Smith on the bariatric sides for pop recovery. So that is really exciting.
I left that out early, I guess.
Well, we're excited because there's just the whole reason both of us got involved with this is we want to have a better future for how our patients recover.
Absolutely. Yeah. And I'm super excited that I get to work alongside you, and since you've joined us, it's been awesome, and it's been so eye opening to see the impact of something as basic as mental health in plastic surgery. To me, bariatrics, it was a no brainer, and I've learned so much, and so I'm looking forward to learning more from you as well.
I was like, the future is bright. So thank you again so much for joining us. And please, y'all, check out Dr. Smith has great content, too. He does a lot of educational stuff on his Instagram. And join us next week for another exciting episode of The Confidence Doc. I hope you learned something today.